Welcome to Logic Medico. Today's interesting topic is ECG. ECG is the electrocardiograph of the electrical activity of the heart, which is recorded on a graph sheet. It's called as ECG. Okay. This ECG consists of following waves. Number one, P wave, QRS complex, and T wave. So this P wave represents the atrial depolarization, meaning the conductivity within the atrium or the SA nodal conduction which has happened, the impulse which is generated from the SA node which has gone to the atrium. So usually the P wave is half the size of the T wave, which you can see in the graph. That is the importance of P wave. Any abnormality on the P wave represents the problem in the atrial depolarization or the atrial contraction, or it can be a SA nodal problem as well. Moving on to QRS complex, as you can see, the QRS complex, the initial negative wave is Q, the peak which is formed by two big squares, this is R, and the other negative wave which is twice the size of the Q is S. So this complex is called QRS complex. It represents ventricular depolarization. Following atrial depolarization, there should be atrial repolarization, right? So atrial depolarization should be followed by atrial repolarization, but the atrial repolarization is very minimal. Okay, it is really a small wave. So when the QRS complex, when the ventricle is depolarizing, the atrial repolarization is not visible. It is hidden. It is hidden or overlapped by the QRS complex. Just imagine a lion is roaring in the forest. Okay, and you are also screaming. Lion's voice is heard. The lion here is the ventricle and you are the atrium. So atrial repolarization is overlapping the ventricular depolarization. Now the question arises, why the QRS complex is so tall and why is it the width of this interval is so short? The answer is very simple. The QRS complex, it signifies that the heart during the depolarization activity, when the depolarization spreads in the atrium, it takes some time. So that is P wave. Okay. While the bundle of His from the AV node spreads towards Purkinje fibers, the time taken is really minimal, meaning ventricular depolarization is really minimalistic when compared to the conduction within the ventricle is really minimal. The time taken for the information from going from AV node, bundle of His, Purkinje fiber is very minimal. Therefore, QRS complex also the width is very minimal. And because the ventricular musculature is thick and compared to atrium, therefore there is a peak or a tall wave. Because the musculature is really thick, the amount of depolarization is more. Moving on to P